COVID-19 patients and their families are concerned about just how much it will cost to be treated for the illness. With at least one new drug showing promise, Joe St. George takes a look at what you or your insurance company could be asked to pay.
As COVID-19 continues to paralyze our lives in laboratories all across the country, the race to find a cure, or at the very least a treatment, is on. One promising solution is remdesivir, developed by Gilead Sciences, with the National Institute of Allergy and Infectious Diseases recently publishing hospitalized patients with advanced COVID-19 and lung involvement who received remdesivir recovered faster than similar patients who received placebo. But how much will this cost?
We looked at the fair pricing from two different perspectives.
Dr. Steve Pearson is director of the Institute for Clinical and Economic Review out of Boston, who says $4,500 would be the fair price for the treatment based on his team's research. What will Gilead charge? That's unclear. It could be more, it could be less. But the company does have a history of frustrating some consumers. In 2015, they charged $84,000 for their drug Sovaldi to treat hepatitis C. That breaks down to around $1,000 per pill. So far, the company has donated its entire initial supply of the drug to the federal government, who will decide where it can be used. But eventually, that will change. Pearson says the country should watch more closely what happens next.
It may be that the traditional way of letting a drug company name its price and seeing what the market will bear is just not going to be the smart way for our country or for the world to approach this.
You see, even though the National Institutes of Health, headquartered here in Bethesda, Maryland, have spent nearly $700 million over the years researching coronavirus, the government traditionally doesn't share in the profits or set the price. Well, Congress is keeping an eye on this. This letter has been sent to the Health and Human Services Secretary asking for oversight. Taxpayers are often the angel investors in pharmaceutical research and development, yet this is not reflected in the prices they pay. Democratic Congressman Jason Crow.
If cost becomes a barrier to people getting the treatment or getting vaccines or getting tests, then we're actually not going to solve this public health crisis.
What happens next with remdesivir is very much in the hands of Gilead, with the nation watching. In Washington, I'm Joe St. George.